All right, so this is working internal rotation at the hip. So what you're gonna do is you're gonna have the yoga block between your knees, and that's just to prevent you kind of like side tilting into it and using more of your pelvis to get the motion than you are from the hip. And it also prevents that knee from dipping in. So you just have the yoga block. Be conscious that you're not really putting extra pressure into the yoga block as you're doing the move. So what you're doing is you're just bringing out the foot into, well, it looks like external rotation, but your hips are actually internally rotating. And you're just doing nice and controlled, slow, no momentum. So don't swing it and throw it out. You're actually feeling the motion coming from the femur, rolling in and out, rolling in and out. And so that you're really working, again, that disassociation at the hip joint, but also working those internal, external rotators at the hip joint. So the other way is if you want to start working in a different direction, you bring the yoga block up a little bit, still have it between your knees, and then you're going to bring one leg back, and you're going to bring the other leg in and out. This one's a little bit harder because you'll want to squeeze the yoga block between your knees, and the goal is that you're just moving from the femur, so it's just externally rotating at that hip joint, and you should feel different muscle groups helping with this motion as well. But for right now, let's really work on that internal rotation by getting that foot out. And when you get comfortable with this position, you can put a light TheraBand around the ankles and use resisted internal rotation of the hip. So give that a shot and see how it goes.